Fleming, and I am the State Director of Birth to Five, Illinois, and I welcome you to tonight's live webinar for community engagement. Tonight's session will be recorded, which you just likely saw on your screen as I did. For those who aren't able to attend, or if you want to share it with someone, it will be posted on our Facebook site, which you can actually find. There will be a link at the end of this video, as well as on our website. You can find the link to our Facebook page. We welcome you to share it with anyone who wasn't able to make it or anyone you want to encourage to participate. For Spanish speakers, we are offering live Spanish interpretation this evening. We're going to pause for a second now, and so Gabriella can come on and give directions for those who want to transition to the Spanish language station.
Thank you. Hello, everyone, and welcome. I'm Gabriela, and I'm the Spanish interpreter, and I'm going to switch very quickly to Spanish to guide the channel selection for Spanish. Muy buenas noches, ¿cómo están? Soy Gabriela, bienvenidos y bienvenidas. Si a usted le gustaría escuchar esta presentación en español, esta noche tenemos un canal dedicado para aquellos que prefieren escuchar esta presentación en español y acabo de poner las instrucciones en el chat. Pero me gustaría darles muy rápidamente cómo hacerlo. Si usted está usando una computadora, por favor vaya a la parte inferior de su computadora. Va a haber un globo del mundo que dice interpretación. Por favor, dele clic y seleccione español o Spanish. Si usted está usando un teléfono, un iPad o una tableta, por favor toque la pantalla de su equipo. Presione los 3 puntos en la parte derecha e inferior de su pantalla. Escoja lenguaje, interpretación o interpretación de idiomas. Una vez que haya hecho esto, escoja Spanish o español. Y en la parte de arriba a la derecha de su teléfono, por favor, escoja done, la palabra done, D-O-N-E, o finalizar o listo. Una vez que usted haya escogido una de esas 3 palabras, inmediatamente va a regresar a la pantalla principal y va a ver en la parte izquierda de su pantalla que dice Spanish o español. Si necesita cualquier tipo de ayuda o asistencia, estoy aquí para ayudarlos. Déjenme saber si necesitan ayuda. Muchísimas gracias y disfruten la presentación. Thank you.
Thank you. If you would like closed captioning to be activated on your screen, please click the CC or live. Actually, Britton, can you go to the next slide, please? Thank you. Please click the CC or live transcript button at the bottom of your screen. The closed captioning is auto provided by Zoom, so we apologize in advance for any errors it might have. We changed tonight's format from a town hall to a live webinar to ensure high quality experience for all, to make sure that we can capture everyone's thoughts without invading their privacy, and then put that up on our YouTube, as I mentioned earlier. Our goals for tonight are simple. We want to introduce you to our state team, share more about the work of the Birth to Five Action and Family Councils, and simply answer your questions. Some of the information shared tonight might be familiar with some of you all who came to our kickoff or another meeting. Please be patient with us, as there is also lots of new information that we will provide this evening. The chat feature is open. I see many have already used it. We encourage you to do that. If you do have a question you would like us to answer tonight, please use the Q&A button at the bottom of your screen as well. That will allow our staff to make sure we capture every question and we can answer it in the chat, and then we will also be trying to read them out loud so everyone can understand what was asked and what was answered. We will answer questions that were asked and submitted in advance first, like here, that were asked and answered in advance first, and then we will move on to those that are submitted in Q&A. After that, we will unmute people who raise their hands so they can ask their questions live tonight. So we will try our best to get through all the questions. If we do not get to your question, please feel free to email us after. You can either email Lori or you can email info@birth5il.com, and we will answer your questions. We also have a very extensive FAQ on our website that you can visit in case you think of a question afterwards. It's likely that it's already there. Lastly, people have asked, and while we do support educators, we do not have any certifications we can give tonight for continuing education or professional development credits. Next slide, please. So Birth to Five is a new initiative, and therefore we had to make a new mission and vision. Our vision is there before you, reimagining a more equitable early childhood education and care system that ensures family and community voices centered and prioritized at every level of decision-making in the state of Illinois. And our vision, and our mission, I'm sorry, I keep messing those up. Our mission is to create a statewide regional infrastructure that will amplify input from communities in the development of policies and funding priorities. We mobilize communities to build and sustain equitable access to inclusive, high quality early childhood services for children and families in the state of Illinois. Next, we'll look at our values and our goals. So our first value, you might have guessed, is family voice. Through this transformation centered on authentic family and community engagement, we will address the inequitable distribution of resources and services and rebuild our state's early childhood education and care system. Next, we want to make sure our work is centered around racial equity. In an effort to move our early childhood education and care system to one where race is no longer a predictor of a child's success, we will address barriers that have limited access to high quality services for minoritized students in every corner of our state. And we're going to be working from a racial, and collective impact framework. Birth to Five Illinois will build a system that harnesses knowledge directly from families and mobilizes decision makers to ensure new and/or expanded services are created to meet the community's needs and directly influence policy and funding at our local, regional, and state levels. So we have some lofty goals, but we are confident that with your help, we can get there. Next slide, please. So our state team is listed here. I will say we are running 2 sessions per night so that we can cover the entire state. And so everyone on the screen is not here. But as I said, I'm Cicely, I'm the state director. Jess is on the call as a project coordinator and is our webinar extraordinaire. Sonia Clark is not on our call tonight. She's on the other call, but she's the director of operations. Maggie is our communications manager. She also is on the other call. Dina is our family and community engagement manager, also on another call, not with us tonight. David is with us tonight. He's our family and community engagement coordinator. And Angela, our newest recruit, is on our call tonight as our grants and relationship manager. So I wanted to let you know kind of who is working on your behalf at the state team. And if ever you needed to get in touch with someone who you're looking for. Also, as part of our team, are area coordinators. So on our call, many of you might be familiar with Lori. She's the area coordinator for Area 6, which covers the region that the area we're speaking of tonight. We also have Kareen in Area 1, Dana in Area 4, Diana in Area 2, Kim in Area 3, and Kim in Area 5, and Jackie in Area 3. They are working fast and furious, kind of our boots on the ground, first step into community. So you might have engaged with some of them. They have been key in getting us connected, and hopefully you've had a chance to meet your area coordinator. If you have not, I'm sure Lori will chat you up in the chat tonight, and you'll get a chance to put a name with the face when she comes on later. Next screen, please. So what is Birth to Five Illinois? Birth to Five Illinois came out of the Governor's Commission for Early Learning, and direct result of that work is a partnership with the state of Illinois and Illinois Network for Child Care Resource and Referral, which we call INCRA. We are tasked with creating Birth to Five action councils and family councils in each of the 39 regions around the state of Illinois. We are currently working to align our work in the city of Chicago, and so that one will be launching pretty soon with Every Child Ready Chicago, which was a current initiative already working. Chicago is its own region, and so we're working to align our efforts with the kickoff that will happen in the Chicago area on April 6th. So if you're interested in that region, please follow our website to get more information. Our councils, as I said, are 39 around the state. They are going to share the regional boundaries with the ISB Regional Office of Education map, but they will operate independently. We do look to partner with regional offices of education and ideally have their superintendents on the councils, but we are an independent entity. There are several important goals to our work. One is to support local residents in coming together to address early childhood needs within their own communities. The second is to make sure the state's policies and funding priorities match the needs of each region And those needs are going to be prioritized based on family, provider, and community need. And lastly is to provide equitable access to high quality early childhood services for every student. It's very important that we emphasize that we want to do this work prioritizing the voice of families and providers. Currently for our state, we are in the process of hiring regional action council managers all throughout those 39 regions. As I mentioned, Chicago will be getting going April 6th, and so we'll post a job for Chicago at that time. These managers will be charged with the overseeing of the formation of the councils and then all of the work of the councils. Once the managers are in place, they actually will have the opportunity to hire 2 more staff, a community engagement and an admin data staff for their office. And so all those jobs are listed not only on the INCRA website, but also on the Birth to 5 website. We'll now be allowing transition into David, who I introduced you to earlier, who's going to take us through the work of the actual councils. We have the next slide, please.
Great. Thank you very much, Cicely. Yes, my name is David Quiroz. I am the Family and Community Engagement Coordinator with the Birth to 5 Illinois State team. So like Cicely mentioned there, we're going to start talking about the council and kind of their duties, who we're looking to have in these councils, and kind of possibly a timeline as to when we would like to get started actually formalizing these groups. So we're going to start off talking about the Birth to 5 Action Council. So on your screen now, you see a couple of roles that we're looking to have within this council. And the first one you're going to notice is that parent and family members. We need that family voice within the Action Council. We'll talk a little bit about the role of the Action Council in the next slide, but here's who we're looking to have in this group. And I won't read through all of them, but just highlight a couple. Of course, Head Start and Child Care Center staff, local school district superintendents, local and county elected officials, higher education, healthcare, members of the faith community. So really, these are your community stakeholders who are already aware of some of the challenges that region might face and can actually put some ideas and have been thinking possibly about some ways to improve the early childhood landscape in that region. Next slide, please. So as part of the Birth to 5 Action Council, community members will be an important part of that leadership team, providing direction and vision for this work. These are just some of the roles that the Action Council will have, obviously identifying gaps in the early childhood landscape within that region, amplifying the voice of families. That is going to be crucial to the work ahead, as working with local coalitions and collaborations if they exist within that community. Communicating and keeping the community up to date on everything that's happening and the conversations that are taking place in the Action Council will also be very important. Of course, collaborating with us, the state team, keeping us informed and ultimately working to conduct that regional scan and that annual report that you see there at the end of this year by December 2022. Those are big pieces that we want to get going on as soon as there's interest and as soon as these councils are ready to be stood up. Those regional scans and the annual report are going to be something that the Family Council and the Action Council will work in tandem. The Family Council will be an advisory for this work. So these are just some of the roles, the things that the Action Council is going to be doing. Next slide, please. Okay, so requirements and commitments of the Action Council members. So obviously one of the things we're looking for is that you live or work in the area that you form the Action Council for. We want you to have an idea of what's been going on in that region and be able to speak to it. Of course, if you've received early childhood services in that region, that counts as well. This is a volunteer leadership role, the Action Council. Again, these are those community stakeholders. We anticipate approximately 2 meetings per month to take place for this council, as well as the Family Council. And we're looking for a 2-year commitment if you're looking to join this Action Council. Wow, there will be the option to start at a 1-year commitment and then later decide if you'd like to continue into your 2nd year, or if 1 year is all you're looking to contribute at the time. Of course, there'll be other ways to be involved in both the Action and the Family Council, even if you're not sitting at the table with the rest of those members. There will be a stipend also for those family members that we're looking to have in the Action Council. We're looking to have about 2 family members within the Action Council, and they will receive a stipend for their experience and their time. Next slide, please. So now let's talk a little bit about that family council. Family voice is obviously crucial to the work we're trying to do. So it's very, very important that we get a good, diverse group that covers all of the regions and really focuses on that priority population for that region. So we're looking for families with children under the age of 8 or that have had experience with the early childhood programs and services in that area that can speak to their experiences, that speak to what they lived. Family councils will also be like the Action Councils, around 15 members, give or take. That's would be an ideal number for us to reach. Next slide, please. So what will the Family Council do? Well, the Family Council serves as that advisory committee to the Action Council, right? They're going to share that input, share their experiences, give feedback on things that they're seeing, on things that they're hearing within their community. They're going to advocate for other families, right, who might not be in that Family Council in those 15. They're going to identify the gaps in their community and, of course, raise issues of concern from the community to the Action Council, and it will then feed to that assessment that's going to take place for December 2022. Next slide. So who can be in the Family Council? What are the requirements? Again, we're seeking a very diverse family representation in this group. We want all roles, every diversity piece that you can pull from that region. We want it identified in the Family Council. It should mimic what the landscape of the region looks like. This is a leadership role. This is a paid leadership role. So there will be a stipend for families to participate in the Family Council. Their time, their experience is very valuable to us. So we want to make sure we can compensate that time and that experience. Again, we anticipate approximately 2 meetings per month for the Family Council as well. And the same, we're looking for ideally a 2-year commitment to be in the Family Council with the option to start at 1 year. And then if you'd like to continue, that door is open for you to do a 2-year commitment. And then we want to rotate in some families so we can get some new experiences, new ideas that are taking place as hopefully the landscape is changing, getting more of that voice. So next slide, please. Perfect. And I'm going to pass it on to my colleague now, Angela, who's going to talk a little bit more about partnering with the community collaborations that are already doing some of this amazing work.
Thank you, David. Good evening. My name is Angela Hubbard. I'm the Grants and Relationships Manager for Birth to 5 Illinois, and I'll talk a little bit about partnering with community collaborations and next steps. Birth to 5 Action and Family Councils will work as partners with local collaborations throughout the state, both to help them build capacity where possible and to share information regarding future planning. Action and Family Councils will not replace or duplicate work of local community collaborations. Ultimately, our goal is to make the community work easier with a new governance and funding model for early childhood education and care statewide, one that's actually based on the needs of young children and their families. For those organizations already working on the regional level, our leadership team has engaged in conversations about aligning efforts. In addition, with more, sorry, I lost my place there. One second. In areas with more localized efforts, once hired, the regional staff will look to build on the work of the collaborations by ensuring the gaps, barriers, and expansion needs they have already identified are highlighted in the regional scan. In addition, through this work, there'll be new efforts in engaging families and providers that have historically been left out. It's our hope that Birth to 5 Illinois is seen as part of the community system and an additional early childhood education and care advocate. Finally, a $1 million funding opportunity will be launched this spring to help collaborations regain and increase enrollment in early childhood programs, especially programs that saw decreases in enrollment due to the pandemic. More information about that will be shared as it becomes available. Next slide, please. Now about next steps and how to get involved. Both the Birth to 5 Action and Family Councils will be community driven. Birth to 5 Illinois is providing the infrastructure and support to ensure there's equitable representation on both councils created within each region. We're ready to stand up councils as soon as the community is ready, just as David mentioned. Now we need you and others in your community to complete an interest form so we can see where there is interest and where we need to increase our outreach efforts. You can complete an interest form for either your region's Birth to 5 Action or Family Council. Interest forms are available in English, Spanish, and Polish on our website. Please visit our website, which is also available in English, Spanish, and Polish, to learn more about our work and how you can get involved. We encourage everyone to visit our frequently asked questions, a page that is often updated and also includes answers to the numerous questions submitted to our team during our virtual regional kickoff events in early February. Next slide, please. There's a little bit more information about how to get involved. We have open positions right now. If you're interested in applying to one of those, we're currently hiring 39 Regional Action Council managers, one in every region across the state. Again, the position for the City of Chicago will be posted after our kickoff events on April 6th. We're also looking for a data strategist to join our state team and support the data needs of the Regional Action Councils. You can subscribe to the Birth to 5 email communications to stay in the loop on these and other things. You can connect with us on social media, where the links to our social platforms can be found on the bottom of our website, as well as the bottom of all of our email communications. Next slide, please. And that concludes our presentation for this evening. We're now going to transition into a question and answer portion of tonight's event. And we'll begin by answering any questions that were submitted to us in advance of tonight's session. I'll hand it over to our wonderful Family and Community Engagement Coordinator, David, who will lead us through the questions. Great,
thank you, Angela. Like Angela mentioned, we're going to go through some questions that have already been submitted ahead of time, and we're going to start with one that was, it came from your region, from that Area 6 that Lori's been working with. And the question, and I'm going to read these questions, if I'm not part of the Action Council for my region, how else can I be involved? It's a great question. And I think I touched up on it a little bit when I spoke earlier, but the non-council members will have a variety of opportunities to add their opinions and their voice into the work of the Action Council. There, we will be conducting one-on-one interviews, focus group, surveys. So there's always going to be an opportunity to contribute to the work and have that community voice be heard. The councils, of course, the regional staff will be doing an intensive community outreach to make sure that all these assessments that we're working, or the assessment that we're working towards, has that community voice, not just those members of the council. So if you're thinking that the Action Council or the Family Council is just not something that you can commit to right now, there will be other opportunities to have your voice input into this work. So that was the first question I wanted to kind of touch up on. The other questions that we received, just bring them up here. Perfect. One of the questions we've received is, what are the deliverables for the Birth to 5 Action and Family Councils? So in year one, the main deliverable for the councils, they'll be working on connecting and reconnecting the families to services that they were utilizing kind of pre-pandemic, right? For the state's directive, Birth to 5 Action Councils will deliver a full regional scan, also known as that needs assessment we were talking about, for that region, for that early childhood landscape. The report will be generated with support from the Illinois Action for Children. And again, we're looking to have this complete by December 2022. So still within this year. I apologize. So another question that we've gotten is, what is the state currently doing to encourage parents to take their children and enroll them in early childhood programs? This is a great question. The state is currently working on a statewide early childhood awareness enrollment campaign that focuses the family and community engagement strategies to promote the importance of early childhood learning programs that are available in your region. That campaign is expected to launch this month. And as part of that campaign, Illinois Cares for Kids, which is the early childhood consumer education website, is inviting all parents to join Ready for K. Now, if you don't know about Ready for K is a free research-based text messaging program for families. You receive about 3 messages per week, fun messages that are tips and tricks and ideas to do to engage the learning at home, to increase the learning at home. That information can be found on that website, the Illinois Cares for Kids website, and you can sign up for that now. So follow the link. I think it's already on the chat there, and you can find more information about that and see when the campaign launches again, hopefully this month. Another question that we've received is, what is the time frame, right, to stand up these councils, these birth to 5 councils? When can we expect to see some implementation of this work? Great question. So the birth to 5 department, what we're doing is providing a statewide infrastructure, right? We're staffing, we're providing a framework for the communities to work at that regional level. Councils will be developed based on community interest. There is no state timeline for this, meaning that, like I think Angela mentioned, when these action and family councils are ready to get going and stand up, we're going to be right there with them. We want to make sure we staff the positions that we've mentioned first, that regional manager, that regional family and community engagement coordinator. But beyond that, there is no state timeline for this. We are ready and excited to get going when you are ready and excited to get working with us. One last thing I wanted to mention before we go into the live questions you might have now is we have received several questions in the past over the last couple of weeks about child development, early childhood educator compensation, child care assistance, data, and program funding. Now, all these topics are not really within the purview of our work at the Birth to 5 Illinois initiative that we're working towards. We do encourage you to visit that Illinois Cares for Kids website that I mentioned earlier. You might find some of those answers there. I think that would be a great place to start. And they might be able to direct you and where you can find more of that information. I'm also going to add the INCRA website might also be a great resource to look at some of those questions to see if they've been answered. So those are the questions that I wanted to go over that have already been submitted, and I'm going to pass it on to Jess to see, do we have any questions that have been submitted tonight?
I'm not seeing any yet.
Okay.
Lori let us know an update on the interest forms, that there's 12 for the regional councils for Region 30, and 8 for Region 21 and 5 for Region 20. So just to see where we're at there. And if anyone has any questions they want us to answer, you can go ahead and type them into the Q&A box, or you can raise your hand and we'll call on you and unmute you.
And since we launched, I would just say, since we launched that interest form, there have been some accessibility changes made there. And so I believe you can now print it. Just maybe you want to say what those changes are so we can make sure that form is available for everyone. And just to clarify as well, we're using that form just to kind of not only gauge interest, but to make sure, as David said, the councils are diverse. And so it's not about a right answer. It's not about how many years you've advocated or you've been on another committee. We really want to hear from a variety of voices. So just as much as we want to make sure we have people who have, lots of knowledge about early learning, we want to make sure we have people who are just interested in improving things in their community. So please, when you look at that and you answer it, do your best to answer, but it is not at all any kind of performance indicator, and we're going to pick people with the best answers.
We got a question, and in the future, if y'all can put them in the Q&A box, because then we can track them and type them there as well. But it's, what will the council work on exactly? For example, what would the agenda of the first meeting look like?
That's a good question. So as David said, our ask is it's deliverable at the end of the year. We've partnered with Illinois Action for Children. They'll be providing some technical and training assistance to get people, familiar with a lot of the acronyms and data points. But the council will really look like what the community wants it to look like. And so I imagine, that first meeting is probably getting introductions and kind of going over the deliverable, which was that regional scan, and then also, figuring out when and where you all want to meet. We're leaving that up to the council as well. And so the council manager was responsible for pulling everybody together to assess those kind of logistical things. And then each agenda will be, I would imagine, you all asking questions and wanting to gather more information, and our staff getting that information together and, getting you a formalized agenda, getting you whatever notes you need. And so when you get to the next meeting, you actually can get right to work. You're not actually doing the work to find the information, but we're going to present that to you. And then you'll move along through that process. Imagine maybe there might be focus groups you all want to do to speak to certain people, or interviews or guest speakers. And, those will be a lot of things that you all decide based on your region and your needs and things you want to understand about what's happening in your region. Yes, I will explain more about the deliverable. So the deliverable, which we're calling a regional scan, really will go over all the data points for early learning. As we've mentioned, the data points are not the best, but we will go over census data. They'll go over, kind of the early learning data. They'll go over school data. They'll probably look at some demographics and socioeconomic data. We'll also do, if some kind of a assessment, like where are the preschools, so probably some mapping where early learning experience is happening, what kind of services do you have? So just a full landscape of everything early learning in the community, and probably touching on things that impact early learning. And so, are there transportation barriers? Are there time barriers in terms of people working at night and centers closing at 5? And so it's really going to be a quite extensive documents to help us understand what's happening. Again, a lot of the data points and such, our team and Action for Children will be putting together, but we'll be looking for you all to help us fill in the blanks, and also to put in that qualitative piece that the data points don't show us.
So I think the other part of this, and this came up on the Tuesday call as well, is that, data is only good for that one point in time. And so things change. And so, for instance, in this region, we've got some new centers that are looking at opening up, which is very exciting, right? But that's not going to show up right now in the data until those things are really up and running, and we're to this next year of data cycle. And so, as Cicely talked about, it's the context of that data that is so important, that, when people submit grants and a grant reader is in Chicago or in Springfield or wherever they are, they don't really understand or can't understand from those numbers what the community needs really are. And so, one of the things with this group is that, you're going to be providing the context to that data. You're going to be able to provide that story. And so when there's people are talking about real needs, sometimes it looks like there's a need. I gave an example the other night where, Metropolis, for instance, was a childcare desert, but a lot of people worked in Paducah. And so they were taking their children across the river, and they were taking their children to childcare in Paducah. So the gap wasn't as big as the data, for instance, would indicate. And people in that community knew that. So a group went in and they were looking at building a new childcare center there. And when the community all got together, they were like, no, that's not really what they needed. They needed some non-traditional care hours to match the riverboat, or they needed something else. And, it looked very different to the people that lived there versus just looking at those numbers from ICAM or from ISBE or whatever. I think the other thing that will happen is a end result of these councils, and so Cicely's talked about this quite frequently, is that we will create some new advocates and people who know about the system needs. And so when you talk about a cross-sector council, all of a sudden you've got business owners who really understand what's happening in early childhood, and you've got leaders, economic development and planning, and faith leaders. And all of a sudden you've got people working together, versus for many, many years, early childhood has kind of really been their primary advocates for early childhood services. And what we hope is that people will become much more knowledgeable about where the gaps are and the importance of these services to your community and to our communities. And so then we will have this where we work together and advocate for the policies and programs and services that are really needed and serve the most at risk and the people that have missed services altogether because of some barriers that might have existed that policymakers can't know from afar.
Thank you, Lori. Lori's very good at anticipating what questions are there before they can even be asked. Again, as looks like we're wrapping up shortly. If anyone has any other questions, we have plenty of time left for you if you want to raise your hand, come off of mute, or type in the Q&A box.
And we do have a regional collaboration in Southern Illinois, the Southern Illinois Coalition for Children and Families. So people have asked, so how will that work? And we have some more local work where people are starting collabs. So some in Johnson County, some in the city of Carbondale. So one of the things is that the regional collaboration has set one of their goals to be an impact accelerator for this work. So what that means is that they will be working on kind of some of the overlay priorities, workforce, connecting families to resources, things that will help boost the work of each of the councils. And then what is happening with some of our local groups, there'll be hopefully some funds down the way that will help build up some of that work where their community is really trying to develop their own local collaboration to really coordinate that work. So, they've been very intentional, and I'm appreciative of the intentionality of the planning to make sure that this is not duplicative, but it builds on the work and it's aligned with the work. And it really brings some real new capacity to systems building to Southern Illinois that we haven't seen in a long time. Everybody's done this work in addition to their jobs. And so now we've got some people that it will be their job and primary focus to do this community planning and to really think holistically about what children and families need in their communities.
Amazing. As you all think of any last minute questions, we'll go ahead and pull back up our last couple slides to reiterate some action steps and share those last links again. But if you think of questions still, you can use the Q&A box or raise your hand.
Yeah, so just a reminder, these are some links for you to check out and fill out if you'd like to get involved. This is, again, a chance for us to see where people are interested. It doesn't mean you can never join the council. You can join the council once it's up and going. As David laid out, we kind of have this picture of about 15 or so people from different places around the community that will be on the council, but that's going to look different in each region, right? So we're trying to launch something that's statewide, and so we needed a framework, but we also want this to be community driven and make sense for the community. So we'll have areas where they have 15 people and it matches perfectly. We'll have areas where they have 7 people and some where they might have 18 people. And so really, if you think this is a work you're interested in, or someone else might be a good fit for, regardless of their their current understanding of the early learning landscape, please encourage them to get involved. Once we have staff up and going, then there'll be obviously more happening in the region for you to get involved with locally and meet the staff, and Lori will still be involved. Our FAQs are on the website, and then as we do get kind of the councils up and going, there's a council page on the website where we can post more information if you do want to start to go to council meetings or meet council members. So I don't think I see any more questions. I'll just double check, make sure I didn't miss anyone's hand up.
I think that's it. I'm going to give you all one more link that will be to the playlist of all of these webinars that we're doing. Yours will be posted probably sometime on Monday. If you want to share it or rewatch it, look out for it on that playlist. And Lori said, don't hesitate to reach out. You all have a true gem down there in Southern Illinois, so definitely take advantage of her. And with that, like Cicely said, thank you all so much for being
Here's
here.
another question. Will there be an FAQ after all the regions meet? If you mean meet in terms of like this community webinar, yes, we update the FAQ almost every day. And so as we start to get questions and we talk as a team and realize some of the questions are either ones we hadn't thought of or ones that we're getting a lot, we do update it. And so we won't necessarily put all the questions that were asked tonight into the FAQ, but if there are questions that we think everyone needs to know, or we're hearing a lot, we definitely update the FAQ.
Thank you, Colleen. Really great questions. Appreciate it. Great. Thanks again, everyone. We hope you enjoy the rest of your evening, and we look forward to continuing to work with you all.
Thank you all. Have a good evening.
Have a good night.